back in 8:23 talking about men's health and the very serious issue of prostate cancer. Joining us this morning is Dr. Brian Stone. He's a urologist at Walker Baptist Medical Center in Jasper, and he joins us this morning to talk about some pointers for early detection, but also the controversy surrounding those PSA blood tests. Good to have you with us, Doctor.
Good morning. Thank you for having me.
You know, and first I was going to say that you know, this is an issue for older men, but obviously prostate cancer can also happen in younger men as well, right?
Absolutely. Yeah. The controversy was created by the United States Preventative Services Task Force. They gave the PSA blood test a D rating, but they've changed that back to a C, which means it's an acceptable test. PSA happens to be the only blood test we have that can give us an early indication of risk of prostate cancer.
Right. Now, and for people to understand, now for men who've had the prostate exam, you know what that involves. The PSA test, you know, when you go to have your blood test, you ask for that. Describe people what the PSA test is looking for, what you guys see out of that that would tell somebody that there's an indicator they might get prostate cancer.
PSA stands for prostate-specific antigen. It's produced by only cells of the prostate. Normal range is 2.5 in men under the age of 69. Anything above that is suspicious. We have some new technology now that we can do a MRI of the prostate and fuse that image with the ultrasound, making our biopsies more specific and hopefully reduce the number of unnecessary biopsies.
Oh, yeah, absolutely, because you know that's an issue. Now, how early should somebody, a male, start to get tested for prostate? How often should he get the blood test and check for the PSAs?
That's a little controversial. I would say high-risk males, men who have a first-degree relative like an uncle or dad or brother with prostate cancer should probably start at around 45. Men who have no risk should start at 50. Men of African-American descent should start earlier, maybe at the age of 40, to get a baseline PSA.
And how often, like maybe every birthday?
Once a year. I started at the age of 38 because I have 3 relatives who've had prostate cancer.
Oh, goodness. All right. So, and on that note then, what are some ways we can prevent it, whether it's through health, supplements?
We don't really know the cause of prostate cancer, so there's no real prevention, but exercise, keeping a good weight, eating healthy may be helpful.
All right, and what about treatments now? Have they become more advanced to save more lives?
We've come a long way. The surgical management now is performed with the robot, which means lower hospital stay. My patients go home the next day.
Oh, wow.
Minimal blood loss, much greater ability to preserve the nerves for erections. Continence rates are better.
Right.
Meaning that you don't necessarily leak like you did when we were doing it the open way, the old-fashioned way. Radiation treatments have become much better with much lower side effect rates. For advanced prostate cancer, there's genetic therapy, a whole host of new treatments. So there are quite a few options now. Well,
that is encouraging news. So we hope folks get out there and get tested. It's very important you do that because the statistics, they're not good. I mean, there are a lot of men dying from this.
Yeah. The number of diagnoses we expect this year is about 161,000 with about 29,000 deaths.
All right. Sorry. Got to do something. Dr. Stone, thank you so much.